Hi, I know you all are excited on the topic which we are going to discuss today, which is essential as being a nurse, and we come across this particular incident in our day-to-day life. So I would like to give a short scenario on why this particular topic is important. Yes, so during the clinical posting, we all have come across that patients may need a particular sort of medication administration where a patient is unable to take it through oral. It's none other than parenteral route. So the common parenteral route, we being the nurse who are independently able to do the procedure, is IV insertion, or you call it as IV cannulation. So in today's class, we are going to see about what is the major side effects of a patient who is receiving a IV cannulation. Whether the patient may receive medication or not, but still, when the cannula is in situ, what are the things we can do prior procedure, after procedure, or might be during the procedure. So in today's in this session, we'll be covering a subtopic of which is how do you assess or how do you find out that the patient is having phlebitis. We all are aware of what is itis. Yes, my dear students, you know that it is the inflammation. So phleb, which is related to the vein. So here, inflammation of the vein, we call it as phlebitis. And as a nurse, we are going to see how this phlebitis is happening during cannulation and how do we assess in which grade the patient is falling. So coming to the introductory part, in this picture you can see that the inflammation which is occurring into the vein. So we all will be surprised. Ma'am, you may ask me one question. Ma'am, we are introducing the cannula into the vein. We are not injuring the adjacent tissues, but still why this infiltration, extravasation on all these complications happen. So as I told you, the introduction is that it is the inflammation of the vein. So phlebitis will be occurring with or without a blood clot. It can affect as well as the deep and the surface veins as well. So here when we relate, it is only the surface, that is the superficial veins, which we call it as either phlebitis. If it is evolved with the formation of blood clot, then we call it as thrombophlebitis, which is inflammation which has occurred due to the IV insertion technique. So the definition of phlebitis is again, it is the inflammation of the vein near the surface of the skin where the cannula is inserted, and this often might be, if it is not serious, it is resolved on its own, but according to the grade of skins, it is having the different type of healing property. So coming to the etiology of phlebitis, so it is either due to the mechanical irritation. So we all are aware mechanical is nothing but some force, some friction. So this mechanical irritation is either due to the catheter tip that is irritating the vein wall. Then the next major cause, even though you have properly fixed the IV cannula, but still you find that there is inflammation, it is majorly due to the side effects of the medication that is passing through the vein, which is caused by chemical irritation. And the next important or major cause of the phlebitis is that infection, which is might be due to bacteria or other microorganisms that is very close to the IV site. This is leading to infection and inflammation. And phlebitis can also accompany along with the blood clot, where we call it as thrombophlebitis. So these are the possible etiologies. So children, I think you can now get my point that why it happens, why this inflammation of the vein happens, either through mechanical, either through chemical infection, or might be due to thrombus. So yes, before going into the grading of scales and treatment, we have to know how this is taking place. What is the physiology behind, or you call it as what is the pathology behind. Just by inserting an IV cannula, these changes happen. So in the first picture, it is very clearly stated and it is very clearly given that So this is the IV line which is being inserted into the vein, and of course you can see the blood cells, plasma and other fluids which is being passing through the vein. So during the cannulation it is actually injuring the vein, which is causing some sort of endothelial damage. So this endothelial damage will cause a disrupt in the blood flow. Disrupt in the sense there is a hindrance in the blood flow. So you can see like a thrombus is first started to begin as due to the platelet aggregation at the site of injury. The second one is that in the picture you can see in this first stage we cannot detect whether the patient is having phlebitis or not. It is always undetectable. But the changes are happening, that is thrombus getting aggregated by platelet aggregation at the site of injury. So that's the first point you have to keep in mind. And the second point is that platelets aggregation will cause the release of a chemical called as serotonin and histamine and bradykinin. So because of these chemicals which is being acting at the IV cannula site, this is promoting more and more vasodilation. So dilation is opening of the vein. Vasodilation, you can see that the veins are opened up and there are large amount of blood being perfused into that particular area where cannula is being inserted. This causes increased permeability of the blood vessel as well as it attracts the WBC to the injured site. So it's nothing but our antigen antibody reaction. As soon as a foreign matter comes into the body, immediately you can see the antigen antibody complex getting aggregated and all these chemical mediators coming to that particular site, and you can see that patient will be having certain changes due to this. So here in the cannula site you can see that the patient starts complaining of slight tenderness. So tenderness is that whenever we try to like connect the port, IV cannula port, or whenever we try to give a medications or touch the cannula, patient is having severe pain on that particular site. So in this second stage you can see that is the second pathology. The symptoms are slight tenderness, there is some sort of platelet aggregation as well. And the third physiology which happens, that is it goes to third stage where you can see that due to the vasodilation and due to histamine released in the blood cells, you can see there are so much amount of tenderness and redness started at the cannula tip. So patient will be having some sort of redness or erythema you call it as. So you can see in that changes to just very close to the IV cannula. And then it proceeds to develop fluid and protein leak from the veins, increasing the permeability of the wall, and you can see there is growing of thrombus into the lumen. So patient is having very much tenderness. Some patients may have also fluid collection, which we call it as edema. And the last two will be like due to the chemical mediators being attracting the leukocytes, there is damage to the blood vessels, and you can see these are WBCs, the white color thing, and you can see some sort of thrombus formation and fibrin getting stimulated. So patient is having tenderness, warmth and edema, as well as you can see the vein is very much red in color. And the last stage is that there are large amount of pyogens being released, which causes the dying of the WBC, or you call it as leukocytes, and they stimulate the production of leukocytes in the bone marrow. So here patient is having 15 centimeters of vein wall palpable, and it is very hard, increased temperature. In these cases, some patients are reporting of severe pain and pus formation at the site. So that is all about what is the pathology or behind formation of phlebitis due to insertion of IV cannula. So here the scoring criteria, you can go give the score from 0 starting, which is the least possible score, and the highest possible score is 5. So 0, we all know that is there is no changes or signs or symptoms in the phlebitis, or you call it as there is no change in the cannula. The cannula is appearing as we inserted on day 1, even on day 2. So we call it as a healthy cannula. The second one is like when you observe the cannula. This is the first possible sign which we give a score of 1. And it is mainly patient is complaining of slight pain at the IV site and there is some redness near the IV site. And when you need to give a score of 2, you can see that early stage of phlebitis which we coined where patient is having either two of the symptoms, either pain, redness and swelling. So in this stage we are not taking any risk. Immediately we are going to resite the cannula, that is change the site of the cannula rather than continuing the infusion on the same IV line. The third score, or you call it as the score of 3, where you call it as the medium stage of phlebitis. So here patient is going to complain of either pain, erythema and induration, that is infiltration of the fluids. So here also you are going to resite the cannula and start thinking of some treatments. And when the patient is getting a score of 4, then immediately it is the advanced stage of phlebitis or the starting stage of phlebitis. Don't waste time, immediately resite the cannula and start the treatment. So here patient is going to have pain, erythema, induration and palpable venous cord. So this is the additional point where patient is complaining, where you can feel like the vein is changed into like a tendon. So we call it as palpable venous cord. And the last stage is the advanced stage of phlebitis. So here we have to immediately initiate the treatment and resite the cannula. So pain around the path of the cannula, erythema, induration and palpable venous cord, and some patients are of course having fever, pyrexia. So here you can, if you are doing a proper insertion technique, regular site assessment, like in each shift you're going to see the assessment, and when you're inserting you are taking the appropriate cannula size and an appropriate techniques and avoiding counter punctures, appropriate catheter securement, warm compress at the site whenever patient is complaining of score of 1 or 2, and then early removal of planning of catheters not exceeding more time. So these are the major things which we will plan for the prevention of phlebitis. There are many more according to the CDC guidelines which we'll be seeing in the further class. So these are the possible references which I've done for the VIP phlebitis scale. And thank you so much for your patient listening. See you in the next topic, that is prevention and the possible treatment in detail of IV phlebitis. Thank you.